During the summer of 1997, leaders from Duke Divinity School, Immaculate Conception Church, El Centro Hispano, and Catholic Social Ministries decided to build a broad-based organization where citizens could work together to initiate and sustain social change. Our vision was to create an organization that would break down barriers between people so we could work together on common issues and build the relational power that would affect lasting, meaningful change in our community. From this vision, Durham CAN was born. We chose to use the community organizing model taught by the Industrial Areas Foundation in cities across the United States.
Collectively, we began to raise our own money, recruit diverse institutions, train average citizens in the art of organizing, and focus first on building relationships rather than galvanizing issues. With support from IAF Southeast Regional Director Gerald Taylor, the organization conducted trainings for hundreds of leaders from our participant institutions. In 1999, we raised enough money to hire Chris Bishop as the first full-time organizer. By the year 2000, Durham CAN leaders organized a series of house meetings that involved listening to the concerns of 1,600 community members from neighborhoods throughout Durham. These house meetings were used to develop the first organizing framework which would guide the organization over the next 4 years.
In 2001, over 130 CAN leaders organized 3 neighborhood audits, documenting more than 500 items that needed to be cleaned up in 8 neighborhoods across Durham. That year, we held our first candidates assembly to gain commitments from mayoral and city council candidates to address the items identified by the neighborhood audit. The following spring, over 240 CAN leaders attended a delegate assembly to hold city officials accountable for the commitments they made to us during the neighborhood audit. At that time, city officials reported to the assembly that 90% of the items cited in the audit had been addressed and cleaned up by the city.
In the winter of 2002, 50 CAN leaders audited 14 job training programs. We found empty warehouses that were being promoted as effective job training programs. We agreed to hold an assembly to gain commitments from city officials to evaluate all existing job training programs in Durham through a job training strategic plan. To ensure accountability, 75 CAN leaders attended the final city budget hearing to speak in favor of funding the plan. That year, the City Council committed to do an internal assessment of job training programs. In 2003, we collected 2,200 signatures on a petition that supported the addition of 2 more housing inspectors and 2 support staff positions to the 2003-2004 city budget. 100 CAN leaders presented this petition to Mayor William Bell and the City Council at a public budget hearing. Thanks to the work of CAN, both inspectors and both support staff positions were added to the city budget.
During 2004, 175 CAN leaders attended a Durham County Commission meeting where a living wage policy mandating a minimum of $9.74 per hour for full-time employees was approved. This policy was expanded to include service contract workers and an annual increase. That same year, 150 CAN leaders negotiated with city officials and attended the final city budget meeting to speak in favor of increasing the living wage for full-time city employees and contracted workers. The city voted to increase the living wage to $9.51 per hour and to increase that amount annually. Prior to the 2004 elections, 300 CAN leaders canvassed door-to-door in 15 low voter turnout precincts and called more than 8,000 infrequent voters as part of a nonpartisan Get Out the Vote campaign. As a result of this work, the targeted precincts reported a 37% increase in voter turnout for the 2000 elections.
In the fall of 2005, Duke Organizing, one of our new member organizations, began negotiations with the administration of Duke University over the issue of a living wage for Duke employees.
Between 2002 and 2004, CAN built a broad-based coalition of clinics, schools, universities, community-based organizations, and medical and daycare providers that tested over 2,000 children for dangerous lead poisoning in elementary schools and daycare centers. In the spring of 2005, 28 Durham CAN leaders organized a community forum to increase public knowledge about the local healthcare system. During this forum, the director of the Durham County Health Department made a commitment to review the list of acceptable documents to obtain birth certificates for U.S.-born children of immigrant parents. The next day, the director called CAN to announce that the change had been enacted, benefiting thousands of immigrant families.
In the spring of 2006, 300 CAN leaders attended the Delegates Assembly and gained commitment from the Department of Social Services, Durham Public Schools, Lincoln Community Health Center, Duke Health System, Durham Parks and Recreation, and the Greater Durham Chamber of Commerce to work with us to implement a county-wide campaign to increase the level of Medicaid health choice enrollment in Durham County. Later that fall, we gained commitments from Duke Health System, Durham County Commissioners, business leaders, state legislators, and the North Carolina Institute of Medicine to attend a retreat to study the possibility of creating a county-wide plan to serve the growing uninsured population.
In April of 2007, 500 leaders attended a CAN assembly on the campus of Duke University. During this action, Duke Vice President for Campus Services Kemmel Dawkins announced the university's decision to pay a living wage of $10 an hour and provide health benefits to all contracted food service workers. The announcement was a victory nearly 2 years in the making.
During the same CAN assembly, we secured important commitments from public and private players in the area of healthcare. The commitments included specific pledges from Duke Health System, North Carolina Specialty Hospital, Lincoln Community Health Center, Durham Orange Medical Society, and the North Carolina Institute of Medicine, and 3 county commissioners, to bring into reality a collaborative project to provide much-needed free specialty care to at least 2,400 low-income residents each year. The plan is called Project Access, and it will be implemented in 2008.
In October of 2007, just days before a citywide election, over 300 CAN leaders, along with the chief of police and 7 of the 8 candidates for city council and mayor, attended the fall delegates assembly. Leaders asked the candidates if they would commit to work with CAN to create a $1 million per year fund for neighborhood revitalization, hire 3 new housing inspectors, connect public incentives for businesses to the number of jobs they create for Durham residents, close loopholes in the city's living wage ordinance, and implement a pilot project to rehabilitate condemned abandoned housing. All 4 elected candidates agreed to work with CAN in 2008 to ensure those commitments become realities.
42 diverse CAN leaders attended a retreat with Mayor Bill Bell and Councilman Alian Brown. The purpose of the retreat was to discuss details of previous public commitments made to Durham CAN during the past delegates assembly. CAN leaders discussed specific solutions to deeply felt community concerns, including vacant housing, inner-city neighborhood investment, the lack of housing inspectors, bilingual personnel at emergency services, living wages and jobs for Durham residents. Although more work is needed, elected officials signaled to CAN leaders their intent to keep their commitments.
We look forward to continue working with local congregations, associations, and neighborhoods in identifying and solving local, regional, and state concerns. Durham CAN pledges to continue providing intensive leadership training that teaches people how to use the tools of democracy to improve their communities. We invite you to join the work of Durham CAN as a very practical way to put our collective faith into action.